there are many types of different MS diets. So when people with MS would look this up, for instance, they would see, a huge number of different books and websites and recommendations coming up. And some of the common ones would be the SWANK diet, the Overcoming MS diet, which is very commonly followed in Australia, and other diets like, for instance, the McDougall diet, there's plant-based diets, Wall's diets, and ketogenic diets, all of these types of things. And what a diet really means is that, basically it's a combination of, foods from different food groups. So if we group things in terms of vegetables, fruits, grains, meats or alternatives, and dairy, and alternatives of dairy, which is the basic food groups, depending on what you eat from each of those groups and what you don't eat from each of those, that's pretty much how you then construct a specific type of MS diet. So most recommendations from MS societies out internationally recommends that people follow a balanced diet according to their local guidelines. There is also a big, quite large groups recommending a Mediterranean style diet, which is again a very balanced diet, really, with everything allowed from the different food groups. But as you then move through the types of different MS diets, they change in that they can become quite restricting. So they can actually limit certain food groups partially or completely. So for instance, you could have, a Overcoming MS diet where some foods and meats would be very restricted and dairy products would be restricted, to a full plant-based diet where, of course, you can't have any animal fats. And then, then we're looking at diets like the Paleolithic diet, the Wall's diet, for instance, where certain food groups from a diet is completely eliminated. For instance, you're not allowed any grains, for instance. And with those types of diets, there are potentially more risks, and people need to look at, how to replace those food groups. And usually many of these diets will have some sort of advice on that as well. So that's pretty much how we define a diet. But if we look at the evidence around these diets, particularly if we look at if any particular and specific MS diet has scientific evidence to demonstrate that it can improve MS outcomes, and with that I mean, can it improve relapses, can it improve disease progression? The scientific data is unfortunately not very strong, and the conclusion from a very big review of all of the studies out there, where it was a Cochrane review that was published in 2020, where they looked at over 30 trials with various diets and interventions, and they couldn't find, any evidence that any of these types of specific diets make a difference to MS outcomes in the long term. But that's at the group level. So we don't know, how people on an individual diet might go. And I certainly know that many of my patients who do follow a specific diet, when people eat healthier, they generally feel better. So I think, we can't sort of say that there's no evidence for this. There's just not very strong evidence.